create local jobs, and also reduce the pressure on forest resources. These are some of the targets that this particular motion seeks to attain. The House is about to correct, or it has corrected. Allow me to hand you over.
Settle down, honorable senators. We do have quorum now. Clerk, you may proceed to call the first order.
Order number 1, administration of oath. Order number 2, communication from the chair. Order number 3, messages. Order number 4, petitions. Order number 5, papers. Order number 6, notices of motion. Order number 7, questions and statements.
Now, honorable senators, we were expecting this morning CS Treasury, CS East African Community, and CS Blue Mining. However, they indicated that we're not going to be in a position to attend plenary this morning. They extended reasons which were found to be valid, and therefore we are not going to have the question time this morning. We will proceed with the other business as contained in the order paper. So, clerk, you may call order number 8.
Order number 8, motion. Reports of the Standing Committee on Health on the county oversight and networking engagements in Kitui, Makueni, Machakos, Kiambu, Bungoma, and Kakamega counties. Resumption of debate interrupted on Tuesday, 2nd June 2026.
Now, honorable senators, when this debate was interrupted yesterday, Senator Beatrice Ogola MP had the floor, and she had a balance of 14 minutes. She is not present, so the floor is open. If honorable senators would wish to comment on this motion, you may indicate from your gadget. We'll then proceed to put the question. Yes, I can now see Senator Wamboa on the queue. Honorable senators, acquaint yourself with this gadget and this system so that we make progress. Senator Wamboa, you may take the floor.
Thank you, Mr. Speaker. Mr. Speaker, I am sorry for that mishap. I just want to make a few comments on the report by the Senate Standing Committee on Health. A fairly elaborate report, Mr. Speaker, touching on different counties. And my county is one of those counties that the committee visited. Mr. Speaker, I want to begin by commending the committee for visiting Kitui County to acquaint themselves with the health status in the government of Kitui. The Speaker, on the day that the committee visited, I passed my apologies because I was unable to join them. I was engaged in other matters and duties of leadership. Of Ebola. Now, patients in hospitals in Kitui are sharing beds. At times, actually, 3 patients in one bed. Mr. Speaker, that should not be allowed to continue. That should not be allowed to continue, Mr. Speaker, because, God forbid, if this thing that we are all praying that doesn't come to Kenya, if there was an outbreak of a contagious disease as Ebola, and then finds its way, God forbid, in any place near Kitui, Mr. Speaker, it will be a disaster. It will be a disaster, Mr. Speaker. Mr. Speaker, I want to call upon the county government of Kitui, as their senator, Mr. Speaker, that measures be put in place, immediate urgent measures be put in place to decongest the wards. To make sure, Mr. Speaker, that ways are found, even if we have now to do some bit of application, Mr. Speaker, to get some nice, safe tents where we can have beds, or convert some halls into wards, Mr. Speaker. But the thing about patients sharing beds, Mr. Speaker, must not be allowed. Because in some of these cases, Mr. Speaker, you find that there's a patient who is suffering from, maybe they have malaria. They are now put on the same bed with a patient who has maybe common flu or something. Some of these diseases are very contagious, Mr. Speaker, and the spread will not be able to be stopped if the patients continue to share beds. Lastly, Mr. Speaker, is the issue of drugs. Mr. Speaker, the lack of drugs in our hospital pharmacies in Kitui County is also appalling. I want to call upon the government again, Mr. Speaker, led by His Excellency Dr. Julius Malombe, to put measures in place to stock the pharmacies in our public hospitals. Mr. Speaker, every now and then we have witnessed cases where patients go and see specialists. The patients are prescribed, some drugs to go and get from the pharmacy. They go to the pharmacy, Mr. Speaker. They find that the drugs are not available. So what has happened, Mr. Speaker, is that now we have an establishment of a lot of chemists near the public hospitals, because it has become now like commonplace that the pharmacies in the public hospitals don't have drugs. So business people, have established chemists around the hospitals, Mr. Speaker, to sell drugs to patients. Of course, the cost of drugs being sold in private chemists will be more than what they would get from the public pharmacies, Mr. Speaker. So, Mr. Speaker, I want to call upon the county government of Kitui to ensure that there is proper stocking of the relevant drugs in our hospital pharmacies, so that our people can get better health care. Mr. Speaker, lastly is the issue of the casuals, the employees of the county government of Kitui in the health department, including medics, including nurses, including clinical officers, including pharmacists, Mr. Speaker, who are working on casual basis, Mr. Speaker. These people are providing very critical service to our people. They are actually the first line of defense for healthcare in our county. And they need to be compensated properly, Mr. Speaker. Many times their stipends are delayed, and the excuse always has been, late disbursement from the National Treasury to the county governments. Mr. Speaker, whereas that argument could be valid, a way must be found to ensure that we don't have unnecessary delays in the compensation for the health workers, especially those ones who are on the front line. Mr. Speaker, lastly, is the issue of CHPs. Mr. Speaker, yesterday, I sit in the County Public Accounts Committee of the Senate, and we had an engagement, Mr. Speaker, with the county government of Kericho. And one of the things, Mr. Speaker, that came up was the issue of the compensation for CHPs. Mr. Speaker, this matter of CHPs is not a problem that is specific to one county. It is a matter that is general, is a matter that affects every county in this country. And especially, Mr. Speaker, the structure of the delivery of service by CHPs. Mr. Speaker, you see there's a serious confusion. The national government is supposed to give 2,500 shillings per CHP. And then the county government is supposed to give an equal amount of 2,500. Now, Mr. Speaker, there's a situation where the national government releases part of the pay. The county governments don't have the matching amount to give to the CHPs. So what happens, Mr. Speaker, is that there are inordinate delays in the compensation of CHPs, not just in Kitui County, but in every part of this country. Mr. Speaker, in that conversation yesterday, I proposed, and I want to put it, Mr. Speaker, on the floor of the House, that a way be found, Mr. Speaker, that the compensation for CHPs, the amount of money that is given to CHPs as compensation, why can the government send that money to, the national government, send that money to county governments as additional allocation so that they are paid from one single pool, Mr. Speaker. It happened with the staff working under the Kenya National Library Services. When the government realized that there was confusion in the payment of staff working in the library services, the entire salary budget for staff in counties working for library services was transferred to counties. So counties are now paying the staff, but with money coming from the national government. Mr. Speaker, CHPs are the real frontline staff for healthcare in our country. And I would propose that the government should devolve the entire salary or stipend budget for CHPs so that it goes to the counties as additional allocations, which is conditional for the payment of salaries to CHPs, so that when it is due date for them to get their compensation as a speaker, that compensation is given. And even as we have that compensation as a speaker, a time has come now as a Senate that we must also begin to ask ourselves whether really compensating a CHP with 2,500 shillings is really real compensation, or is a slap on their face, Mr. Speaker. Because the minimum wage for government is way beyond 13, 14, 16,000 Kenya shillings. When you give a CHP 2,500 shillings and you say it is a stipend, what exactly are we doing for these people? Because, Mr. Speaker, you see, these frontline health workers, they traverse villages, they visit homes during the day, at night, carrying a backpack, Mr. Speaker, which is supposed to be filled with basic drugs, Mr. Speaker. When we compensate them 2,500 shillings per month, Mr. Speaker, as a Senate, I think because health is a devolved function, and it is our function, we need to have a conversation on better compensation of CHPs. Mr. Speaker, with those many remarks, I support.
Senator Sifuna.
Speaker, thank you for your indulgence to allow us to skim through some of the reports that the committee has presented to the floor of the House. Speaker, in August of 2023, I attempted to bring a motion here in this House for the formation of an ad hoc committee to audit the state of infrastructure in our schools, and especially on the question of adequacy of infrastructure, given the government's policy of 100% transition rates. Mr. Speaker, whereas we all want our kids to transition 100% from the junior schools, the government had not, in my view, done enough to prepare the secondary schools for the influx of the learners. And the reports that have been put forward by the Committee on Health on the visits to county facilities, health facilities in these counties, is a demonstration, Honorable Speaker, that there is value in committees of this House being present on the ground to see for ourselves and not just to speak from Nairobi here. I had hoped that had that motion passed, Honorable Speaker, we would set up that committee, and maybe some of the things that we saw happening at Tutumishi would not have happened. Speaker, it was horrifying just seeing the state of the dormitories, because we were told upwards of 200 kids were packed into one dormitory that was had a capacity of only 100. I saw pictures of beds actually being put in the corridors, and it was devastating, Honorable Speaker. At that time in August of 2023, I was told that the Senate did not have enough resources for us to support the activities of that committee. Now, if you balance what we would have spent, and I think the budget was about 10 million shillings to audit infrastructure in our schools, and the cost of one life, Honorable Speaker, then maybe we need to reconsider some of these things. I like when committees are allowed to do these audits in our facilities because they bring out the truth. Reading through this committee, Honorable Speaker, the report of the committee, there is a thread in terms of the state of preparedness of our health infrastructure in the counties, be it Kitui, be it Kiambu. Honorable Speaker, it makes for horrifying reading. The story of overcrowded maternity wards is true in Kiambu, it is true in Kitui, it is true even in here in Nairobi, Honorable Speaker. That, for instance, on the report from Kiambu, 2 to 4 mothers were sharing beds, and there's a story that also in Kitui, and Senator Beth was telling me that in Kitui it might actually be up to 10 women on one bed. I don't know how they fit on a bed. Six. Honorable Speaker, this is the true state of our healthcare in this country. We are being told by the report of the committee, the observation that they made from pages 14 to 15 there, Honorable Speaker, that many of the young mothers were not even registered on SHA because of various reasons. They have stated, for instance, that some of them lack IDs. At a time when we are being told that even areas that hitherto had difficulties obtaining IDs, Speaker, that they have been expedited. This was the theme at the recent Madaraka Day celebrations in Wajir. So how is it possible that our young mothers in Kiambu are not able to access IDs so that they can register on SHA? I have seen a good recommendation from the committee there that we should find a way, SHA should find a way of registering these young mothers, even as government processes their registration documents, so that they are able to access this facility. Speaker, our Committee of Health also reported that they were denied access to data on child mortality in some of these facilities. And I don't understand why a committee of this House can be denied access to data, because we have heard separately that some of these counties and some of these facilities are actually understating the number of children who are dying after birth, Honorable Speaker. And we as a committee or as a House should put our foot down and say we need access to that data, Honorable Speaker, so that we can make proper recommendations to help these facilities. Honorable Speaker, there's also the challenge of SHA reimbursements. And, you know, this is the reason why I say it is good for us to visit these facilities and to see for ourselves and to speak to our people. Because when you hear senior government officials speak, and we were in Naivasha with CS Duale, he will tell you that SHA is working 100%. Speaker, just reading through that report, you will see that this challenge is across counties. And I will continue to insist, Speaker, that the promise that the President made was for free universal health care access across the board. And that was the promise that was made to Kenyans when we were being persuaded that those of us who earn a bit more should pay more than what we used to pay at that particular point in time, so that, Honorable Speaker, those who are not able to pay will no longer, will no longer suffer the indignity of having no access to health care. In fact, there was a statement that the head of state made recently, Honorable Speaker, that the harambes that we used to hold, the WhatsApp groups for contributions to support health care, have been closed down. I don't know where the head of state gets this information, Honorable Speaker. Just yesterday, I was trying to call the director at the CEO of the Kenyatta University Teaching and Referral Hospital. Because, Honorable Speaker, there is a friend of mine who passed away. He was one of the clergy at the ADC church in Runda. And when he passed away, Honorable Speaker, there was a bill of almost 1 million shillings. And the hospital, and I don't know why, they have refused to release the body, even after the family has pleaded with them. We have written letters, we have made down payments, we have agreed to a payment plan. Speaker, out of that 1 million shillings, SHA only paid 300. So I want the President to know that we are still contributing money to get our people health care. It is the reality on the ground. And you can see, Honorable Speaker, that even the report of the committee is saying even the facilities themselves are struggling because SHA is not giving the reimbursements in good time. And this is true at Mama Lucy Hospital. We have a debt that is owed to Mama Lucy and all the other facilities here in Nairobi, and we're being told the same is the situation in Kitui, the same is the situation in other places like Kiambu. Honorable Speaker, there is still unresolved issues of NHIF, and the report also addresses this, that there's almost 5 million shillings that is owed to Kiambu Hospital. I think the teaching and not the teaching, the Kiambu Level 5 Hospital from the old NHIF. I don't remember which month we were in Naivasha with the CS, but I remember him giving us some timelines within which the question of the legacy debts of NHIF would be resolved. I think as a house we need to bring him back here because there was reports that he was supposed to give us on what the ministry is doing to address those legacy debts. I have seen complaints about the quality of food in inpatient wards, Honorable Speaker. They have complained about the quality, the portions, even unhygienic presentations, and one that is quite hilarious that the committee noted, or they were told that the food doesn't even have salt, Honorable Speaker. By the time we are discussing salt in food, there's a big problem there, Honorable Speaker, which is why we must continue to insist that counties be given their monies in time and in accordance with the Constitution for them to be able to undertake these devolved functions. The only ray of light, Honorable Speaker, I've seen is at page 29 of that report. For the first time, I'm seeing that at Kiambu Referral Hospital, that they had a properly stocked pharmacy, that there were actually drugs at Kiambu Referral Hospital. They were well stored, well managed with proper records. And these are the few things that when we see, we feel happy and we celebrate that at least somebody down there is doing something. Because when we visited the hospital in Busia, Honorable Speaker, when we were doing Senate Mashinani, you could see when you are approaching the hospital there is a row on your right of private chemists all along that road. And it is always a first indicator that there's a problem in that hospital. That somehow the systems in the public facility is such that you ensure you can guarantee business for the private pharmacies outside. So I am happy that at least that is not happening in Kiambu Referral Hospital, according to the report of the committee. They have said they also saw digital X-ray that is serving almost 100 people per day. It is suspended on the ceiling, and I've seen the photos there. They also reported that Karuri Health Center, Honorable Speaker, is one of the most well-managed facilities they have seen. They have digitized their systems. So we will give Kiambu their flowers for the things that they are doing, and maybe encourage other things, other counties to also follow suit. The story of mortuaries is the same across the country. When we were in Busia, same problem. The same mortuary that Busia has had since independence, Honorable Speaker, up to today, and is in a bad state. Dilapidated mortuaries is a theme across the report. And Honorable Speaker, we continue to reiterate that something has to be done. And when you look at the totality of all of this, Speaker, and then you ask ourselves, is it really true, Honorable Speaker, that our state of healthcare is such that we could be able to deal with any medical emergency in this country? The report paints a different picture. And this is why when Senator for Kitui Wambua was submitting, he said that the concerns that Kenyans are raising about this Ebola facility in Nanyuki is actually a valid concern. We have proposed to the President that instead of us transferring patients from DRC to come and receive treatment here, I think that the US government should grow the capacity of the DRC itself to ensure that that disease does not leave the borders of the DRC. And all of us will be safe, Honorable Speaker. If the money that has been pledged towards this project is given to President Tshisekedi, he should be given that money for him to be able to put up those centers there and be able to contain Ebola within their borders, although now we are hearing reports of even deaths in Uganda, Honorable Speaker. So the state of our healthcare is quite dire, and contrary to what people speak off here in Nairobi and in other public gatherings, they paint a very rosy picture. But the committees of this House, when they go on the ground, the situation that they find, Honorable Speaker, reads like a nightmare, and you can all see in this report. So with those many remarks, I want to thank the Committee on Health, led by the Senator for Uasin Gishu, Jackson Mandago, for this very well-detailed report. They have highlighted challenges, they have highlighted things that they feel need improvement. They have given flowers where they are due, Honorable Speaker, as the case in Kiambu Referral Hospital with their drugs or their pharmacy, and given proper recommendations here. And I think and I hope that once we adopt this report, some of these recommendations will be taken into account and implemented, so that we can give our people assurance that the quality of healthcare in this country is as portrayed by some of the leadership in this country. Thank you, Honorable Speaker.
Senator Sige.
Thank you, Mr. Speaker, for giving me the opportunity to also contribute to the various reports that the Health Committee have submitted before this House. Mr. Speaker, I would like to start by commenting the committee for the well-done report. Particularly and of great importance is the fact that they did indeed had an experience that is reflected in the reports from the various hospitals, dispensaries of the various counties that these three reports have been reported from. And indeed, Mr. Speaker, part of what we have as a House and as various members of other respective committees, we have seen and appreciated the presence of various committees on physical ground or in specific places where we are undertaking our oversight role, unlike where we are doing it in the chamber or here in Nairobi. Mr. Speaker, presence in our respective counties, presence in our respective hospitals where we are conducting that particular oversight, Mr. Speaker, gives us the exact situation, and therefore, as at the time of coming up with the report and the recommendations, we are doing it with first-hand information. Reading through some of these reports, Mr. Speaker, reflects a scary situation. There is outright deterioration of health facilities, not only in the counties that we have been provided for by the committee on the basis of their visits to those counties, but it is a challenge that cuts across almost all the counties in the country. And Mr. Speaker, it reflects on the situation of our health facilities, reflects on the kind of service delivery that the electorate naturally would expect from the county governments, and also reflects on the ultimate service delivery to the people of Kenya. Mr. Speaker, the recommendations that have been given are almost similar across all the counties which have been visited, and as I've said, reflects equally on the rest of the counties. One of the major issues that have been identified, and which is a glaring challenge on administration of the county government managed hospitals, Mr. Speaker, is the capacity of those hospitals. You find that one bed is shared, as we've been told, by more than 3 patients, whether these are mothers who are on their maternity or even patients who've got various ailments. It is impossible to say to get appropriate medical attention when you have got 2 or 3 people sharing one bed. That situation, Mr. Speaker, is common among most of the hospitals where the committee visited, and it is equally reflected in even our various other hospitals where the committee did not. I recall, Mr. Speaker, previously the same committee made a visit to Longisa Referral Water in the hospital. You can imagine, Mr. Speaker, a hospital facility with no tap water. It is absolutely disheartening to see patients going out of the facility getting water from water vendors outside, or even sending, in most cases, like in this case, Mr. Speaker, in Longisa Hospital, I am aware that border riders have now made good business out of water supply to the hospital. They only go, step out, get their 20-liter mitungis and line up along the road in order to supply water to patients who are in hospitals. This situation is serious, and when you look at the report, it can only be appropriately dealt with if our county governments have proper governance, because from the various Senate audit reports, part of the challenge is improper governance. Resources are abused. Resources are directed to non-essential services, and in most cases also, those resources are entirely abused by those who are governing those institutions. Besides the challenge on the bed capacity, where patients are sharing beds, there is also, Mr. Speaker, an availability of essential drugs. This has also been reflected in these reports and is cutting across almost all our institutions of health, which are mostly managed by our county governments. And Mr. Speaker, this one is one of those issues where, as some of the members have spoken to here, you find that the pharmacies within the hospital have got no essential drugs, but there is just outside that particular institution a lineup of private-owned pharmacies where those essential drugs are available. And what happens within the hospital is that patients are given prescriptions and are asked to go and buy for themselves, such that even if a patient was unable to have the financial capacity to purchase and therefore relying on the social health care facility, that's the SHIF, they will be forced to find a way of making sure that they get the drugs from those private pharmacists. And it is one way of, Mr. Speaker, making sure that, the drugs which are normally availed in hospitals, we are told in some places, we don't have drugs in the hospital, but are normally stolen or are sold out to private practitioners who now make money out of it. And that is a problem on governance. It has been identified in these reports that one of the challenges that most of these institutions from the various hospitals that were visited by the committee is that there is improper governance where no one takes responsibility. The hospital superintendent is not available or is not qualified. Doctors, nurses, clinical officers are not paid in time, and therefore their availability to even be present as and when they are required is in most cases discouraged, because their services are not paid for in good time, and their working condition definitely, Mr. Speaker, is compromised. And therefore, if we as a committee, as a house, were to enhance direct and presence in almost all our institutions in the course of our oversight, there is a high likelihood that there will be an improved performance, because being present is not the same as where we are doing oversight at the level where we are in Nairobi, or when we do not have presence in those particular institutions. Another issue that has been identified in these reports, Mr. Speaker, which is also common across, is those health service promoters who, although they are not necessarily under the full obligation of the county governments, they are very essential, and they are the first line of presence in our various areas of representation, because they are the ones who will directly be reaching out to patients. They know almost every other family that has got a patient, and they will be the people who will support in terms of giving directions on what kind of medical attention such people require. And it is, Mr. Speaker, very unfortunate that they are not being paid their stipend. And if they are paid, sometimes they are paid when it's delayed. And therefore, it compromises entirely the service delivery from their part and spills over now to the institutions, the health institutions where they are supposed to report to or where they are supposed to take the patients in. And sometimes also where they know, after all, even if they were to push themselves to support, there will be no attention relevant to the patient in their health institutions because poor governance is present, or no drugs, or at some places, Mr. Speaker, they are literally not even operational. And therefore, the decision that this committee did, together with the rest of the committees, including Education Committee and all other committees, by making their presence felt in the various counties, the role that they are supposed to do will entirely support the people who we are supposed to help as the oversight role. And so, Mr. Speaker, as we appreciate the work of this committee, we'd like to encourage them also to make sure that they enhance their visits and make sure that the recommendations that have been made by the committee on the various institutions are followed through so that some which are possibly able to be implemented should be implemented. Those which are not, of course, will form a basis of future follow-ups by the relevant committees. And Mr. Speaker, I stand to support this report. Thank you.
Senator Siang.
Thank you, Mr. Speaker, for giving me this opportunity to also to add my voice on the report by the Committee on Health. Mr. Speaker, sir, the report touches on Kitui and other counties, and I noted with concern specifically on the matters of the care for mothers and children. Mr. Speaker, when patients are sharing same bed, about 6 patients, and some with newborn babies, it is so unfortunate because babies are sensitive, newborn babies are very sensitive. They can contract infections very easily. And when they are forced to share a bed with their mothers and other strangers, they may contract diseases and that will lead to death. This is very sensitive. I really appreciate the Committee on Health because of these visits that exposed some of these evils that are happening in our counties and in the hospitals. Mr. Speaker, specifically speaking to Kitui Hospital, my attention was caught by what the superintendent, the medical superintendent has done. He has appointed or engaged a pharmacist who did a short course of 3 months on echocardiogram. And she is the one now handling patients with cardiac issues. This is putting the lives of my people in Kitui in danger. The hospital should have an experienced, qualified person who takes care of patients who come and visit the hospital when they have heart diseases. But to be treated by somebody whose training is not on the issue of cardiac issues is very, very dangerous, and it is endangering my people of Kitui County. Mr. Speaker, those things were unearthed when the committee visited the hospital. It is serious, Mr. Speaker, when we engage people and then we don't appreciate their services. I'm saying this concerning the CHVs, whose stipends are delayed, not paid in time, and even themselves, their health is also wanting because they are not assured of insurance themselves. They walk, they work, visiting house to house, door to door, supporting our people. And when their stipends are not paid in good time, they have obligations, because these are people who have families, and they are looking for a way also to survive, if not to live. And when their stipends are delayed and sometimes not paid for several months, they suffer. Mr. Speaker, I would urge the counties as well as the national government, because they share the payment of the stipends, just to hasten the payment and do it in good time. My attention, Mr. Speaker, was also drawn to the situation in our hospitals on electricity. Some hospitals have huge bills with the KPLC, and when they don't pay, maybe electricity could be disconnected. And sometimes, even the situation in the hospitals, the electricity is not constant. Sometimes it goes off, and the electricity power may go off when a patient is on the operation table. What does that mean? It means that a life can be lost. Mr. Speaker, it is very important to ensure that our hospitals are constantly connected to power or to electricity. As some of the governors appear before our committees, Mr. Speaker, we also find out that many do not have disposal framework of expired drugs. They are stocked in the pharmacy, they are expired, and I wonder why drugs with a near expiry date are given to our hospitals or distributed. And this also endangers the lives of our people. Mr. Speaker, as some of my colleagues have already indicated, many of the pharmacies in our hospitals do not have critical drugs or very important and common needed drugs. And when they are not there, then they are directed to go out. Sometime when we went around, Mr. Speaker, I noted something very interesting, that near every public hospital, there are so many chemists, private pharmacies. And when people lack drugs in the hospital, then they are directed to go just outside the gate and buy from there. And some are owned by medics who work in those hospitals, and they stock the medicine that is needed, and so they direct people to go and buy from their own private clinics or pharmacies. I think, Mr. Speaker, sir, we need to have serious follow-up on what happens in our hospitals, so that we ensure our people, Kenyans, are secure, and there are right policies that are followed to ensure that people are served in these hospitals and they feel secure. I want to thank the President of the Republic of Kenya. He is doing very well. The other day, Mr. Speaker, I watched when they were launching the Ewene program, that mother and the child to be taken care of. This is very encouraging, Mr. Speaker. And we should be people who can see good things and say they are good and we are heading to the right direction. I congratulate the President and the Cabinet Secretary for Health, because they have taken efforts to make sure no mother would lose life when giving life to the world. With this, Mr. Speaker, I submit and support the report of the committee. Thank you.
Senator Wamatinga.
Thank you very much, Mr. Speaker, sir, for also giving me the opportunity to add my voice to this job well done by the Committee of Health. Mr. Speaker, sir, I'll start by picking it from the positive note, Mr. Speaker, that indeed the presence of the committee in various counties has highlighted some issues very worrying indeed, lack and shortage of infrastructure, bad services, Mr. Speaker. But I also want to commend the committee because they've given commendations and they've given good remarks on where they found that the hospitals are working well, Mr. Speaker. Indeed, Mr. Speaker, the challenge of health infrastructure in our country has been left unattended the last 62 years. It would actually we would not be doing justice to the current administration, Mr. Speaker, if we don't say that the effort made by none other than the President of the Republic to make universal health accessible, affordable at any part of the country is a very commendable, to say the least. Mr. Speaker, sir, we recall during our independence days that one of the commitments that the founding father of the president said was to fight illiteracy, poverty, and indeed improve health by making health accessible to everybody. Mr. Speaker, over time, the population has kept on growing. The infrastructure in the hospitals have continued to degenerate. Up until the current regime, Mr. Speaker, where the president took very, very unpopular decision, but the right move to make universal health accessible. Mr. Speaker, today, as we stand here, it is not and it cannot be denied by anybody, especially those in the leadership position, that the Harambes in aid of patients have always been a campaign tool, Mr. Speaker. We've been included in WhatsApp groups, Mr. Speaker, and we must admit that these WhatsApp groups have reduced in number. The commitments and the Harambes that are taking place have reduced in number. There are still some cases, Mr. Speaker, and some of them, Mr. Speaker, can be traced back to corrupt administration in hospitals that are highly compromised, doctors that are willing and have always practiced an ethical behavior by charging operations that they've not committed. This, Mr. Speaker, if we are able to address that, and I think that is an issue that have been left severely, if we are able to address that, Mr. Speaker, among other issues, then we'll see the health system in Kenya work. And I think this is a job for everybody, Mr. Speaker. Having said that, Mr. Speaker, there is still a lot that needs to be done in terms of training, in terms of capacity building, in terms of equipping our hospitals, Mr. Speaker. But I think the approach by the government to make sure that CHA is working so that the health system can become a bankable facility where people can go and be able to offer some of these advanced machines, Mr. Speaker, so that we stop sending all our patients to foreign countries for treatment. If we are able to make CHA work in the sense that we can be able to attract investors to come and bring these equipments in our hospitals, then, Mr. Speaker, we will see it work. If we encourage and make sure that we standardize the charges of the drugs and make sure that we also encourage chemists to be established within the establishment so that they can be able to provide these medicines to the people, then we'll see it work, Mr. Speaker. But this cannot be done overnight. What we have been able to achieve in the last 3 years, Mr. Speaker, we must admit that the last 60 years, it has been impossible because the administrations then were not prepared to take the bull by its horn. They were not prepared to make unpopular decisions because they wanted to ensure that they are re-elected. And I must commend the President, Mr. Speaker, because some of these decisions, as unpopular as they are the right decisions that we ought to have made 60 years ago, Mr. Speaker. And this is the time, Mr. Speaker, that we must say, leadership is not about getting re-elected, Mr. Speaker. Leadership is about making the right decision. When the history of this country is written, even when maybe we are not around, it will say, yes, the president did the right thing to do to implement some of these measures. It is our responsibility, Mr. Speaker, as leaders to ensure that we address the issues of corruption in the health institutions, we address the issues of corruption within the professionals, and most important, Mr. Speaker, the ethical behavior of the doctors that we know has also compromised our ability to offer the services. Having said that, Mr. Speaker, It will also be good to say that there are some of the challenges we have in hospital that are caused by mismanagement of those institutions, administrative mismanagement. There are some that are caused by the county governments not being able to facilitate. And I like the fact that the committee did say that they found one hospital in Thika that had a well-equipped pharmacy. This, Mr. Speaker, is a clear indication that if the governors, if the administration around the hospitals were ethical enough, then we'll be able to face this, to overcome this challenge. However, Mr. Speaker, I would also want to advocate for the fact that we need, Mr. Speaker, to devote more funds to the health center as we also create avenues and IT-based administrative tools so that we are able to address the issues around corruption, the issues around mismanagement, and most importantly, Mr. Speaker, be able to trace the data of the patients so that we can be having a predictable situation where we would know in a couple of years to come, these are the kind and the category of medication that we'll be using, the kind of equipment we're using. And in today's age, Mr. Speaker, where AI enables that kind of projection, forward-looking, Mr. Speaker, is something that we should do. Mr. Speaker, having said that, the issue of CHPs, Mr. Speaker, I must also commend the government because as much as the spending they are getting is little, as has been alluded by one of my colleague here, we must look at a way of enhancing that, Mr. Speaker, not only in terms of the money they get, but also in terms of the facilities that they get, Mr. Speaker. Things like umbrellas, things like the clothing, we need to give them protective wear so that, Mr. Speaker, as they are going to see these patients, they do not also contract the diseases that they have. Mr. Speaker, I have made it my duty to go around the 30 wards in Nyeri County, speaking to the CHPs, and I've seen the commendable job that they've been doing. And indeed, Mr. Speaker, I must say that the spend from the government, national government, comes promptly, but that from the county government comes little. However, Mr. Speaker, that is a little amount, and we must look at a way of enhancing that so that we can be able to address some of the issues right at the source before they escalate to become major diseases, Mr. Speaker. Improvement of primary health care, Mr. Speaker, should be a priority to every county government. It should be a priority to the national government, and it should be a priority to every leader, Mr. Speaker. And that can be done, Mr. Speaker, by ensuring that we enhance the services offered by the CHPs. But as we're doing that, Mr. Speaker, we must also find a way of capacity building them, Mr. Speaker, so that now we have people who are able to not only to deliver professional services, but also to be able to give timely services by increasing the gadgets they have. And most importantly, the reporting tools that they are using, Mr. Speaker, must be modernized so that we are able to harness that data, harvest it, Mr. Speaker, and use it in our budget-making process so that we do a budget that is data-driven as opposed to the look and feel, Mr. Speaker. Mr. Speaker, it is also very, very important to say that some of the challenges that we are facing in the health sectors are led by the unscrupulous minded administrators who look at opportunity of making businesses out of this, Mr. Speaker. We know it is possible, and it has been done in other countries, Mr. Speaker. We can achieve it in this country. And what we need to do, Mr. Speaker, is to do a evaluation of what we are doing, standardization, and we create standard operating manuals and procedures within all the hospitals so that, Mr. Speaker, we can have a unified approach into how we deal with medical issues, Mr. Speaker. Lastly, Mr. Speaker, as I wind up, indeed, I would want also to end up by commending His Excellency the President, because SHA has ensured that some of the services that has remained inaccessible to some communities is now accessible. However, Mr. Speaker, we must look at a possibility of ensuring that these counties that are marginalized, Mr. Speaker, that they get modernized hospitals. Mr. Speaker, the approach should be to run all the facilities within our hospitals in a bankable way, Mr. Speaker, in a manner that we are able to encourage and to invite and give initiatives to investors so that they can come and install their machines so that we can reduce the amount of patients, the number of patients that we have to export to foreign countries for advanced treatment. Mr. Speaker, with the advent of cyber medicine, Mr. Speaker, it is possible to have collaboration between local hospitals and international hospitals. What we need, Mr. Speaker, is only to standardize the equipment that we are using, and this can be done when we do have a kind of a public-private partnership within our hospitals that will encourage even those international companies to come and invest in our health systems and making Kenya also a medical tourist destination. And that can happen, Mr. Speaker, if we modernize our facilities and if we go in tandem with the modern technology. Mr. Speaker, having said that, let me take this opportunity to thank the committee for the job well done. How I wish that they would do that more frequently so that their presence and our presence as the oversights can be felt within the county governments, within the county, the grassroots facilities. But most important, Mr. Speaker, I think we have an obligation to ensure that we give civic education to our people so that they get themselves enrolled in SHA, so that they get the services that are offered. Thank you, Mr. Speaker. I do commend the committee.
Senator Dulo.
Thank you, Mr. Speaker, for this opportunity and to contribute to this report of Health Committee of the House. Mr. Speaker, I wish to take this opportunity to thank the committee for having comprehensively outlined the issues affecting our hospitals across the board. Mr. Speaker, right to health is paramount. But unfortunately, in as much as the government at the national level is doing, there is literally very little that is happening at our county levels. Mr. Speaker, patients are really suffering in our hospitals. And if I may start with my own county, yesterday, all the doctors put down their tools. And KPDMU actually advised the county government to have a sitting with them and iron out the issues affecting the doctors in Isiolo County. But surprisingly, they are unable to get the governor of the county of Isiolo to sit down with them to listen to their grievances. And Mr. Speaker, if the doctors themselves are not taken care of, if the doctors are not getting their salaries, if the doctors are not actually covered themselves as far as SHA is concerned, there is no way that they will take care of those patients, Mr. Speaker. And I think if I was actually asked, in as much as devolution, health is devolved, Mr. Speaker, I wish health should be returned back to the national government, because the situation is very bad. Mr. Speaker, service delivery. In the report, you will see that actually most of the infrastructures are dilapidated. And that is the serious situation across the board. And if you look at the budget actually within the county government, you will see that the chunk of the budget of the county government goes to health. But that budget doesn't actually even reach the hospital, Mr. Speaker. Many of the hospitals, and a very good example is of Isiolo, the hospitals are dependent on FIF. Nobody knows where the budget is going, Mr. Speaker. Because if the hospital collects about 2 million, and the requirement of the hospital is almost 2 billion, how will they cover those costs, Mr. Speaker? There is a very serious situation that is happening in our counties, Mr. Speaker. I saw KPDMU actually telling Isiolo people yesterday, go to the hospital and collect your patients from the hospital because the doctors are not going to be there. That is a very serious situation. And I think maybe Senator for Meru should also look at that clip, because Meru was also mentioned. And the patients are told, Isiolo community were told, go to Laikipia or Tharaka Nithi for service delivery. Doctors are not going to be there. It's a very serious and pathetic situation, Mr. Speaker. Mr. Speaker, the issues of promotion, Mr. Speaker, in the counties. as far as the doctors are concerned, nurses, clinical officers, they are all politically driven. If you are not aligned to the current regime, Mr. Speaker, and those are one of the grievances raised by the doctors, you will not be promoted. Mr. Speaker, doctors and nurses, they don't have tools, they don't have gloves, they don't have masks, and I wonder what they are going to do in those hospitals if they are not properly equipped and even protected. You can imagine, SHA is there, but the doctors themselves, they are not covered. Nurses are not covered. The county government staff, they are not covered medically. How will they serve those patients, Mr. Speaker? It's a very serious situation, Mr. Speaker. You will see that the revenue is being collected at the county level. And the manner in which the revenue is collected, Mr. Speaker, you pay cash and it is not actually automated. Casuals have been actually going without salary for almost 2 years. And they are the people who actually do the dirty job in those hospitals, especially cleaning the blood in those hospitals. Patients who are very sick, they are the ones who take care of them. How will those staff, especially the casuals, and I think as a Senate, we really need to deal with the issues of casuals in the county government, because you cannot expect a casual who is earning 15,000 or 17,000 to stay without salary for 2 years or a year plus, and you expect that particular staff to perform his or her work, and we are just quiet. Mr. Speaker, I do appreciate what actually the committee has done, and you can imagine, Mr. Speaker, like a staff of Isiolo County, for the last 3 months, they have gone without salary. 3 months, Mr. Speaker. Some of them, they live in rental houses. And the tenants are saying, if you work for the county government of Isiolo, we are not going to give you a house. You better look for a house elsewhere. SHA contribution is not actually remitted for the staff, Mr. Speaker. They have taken loans, Mr. Speaker. Those loans are not paid in time. Promotion is not coming. And actually, some of the doctors are forced to even go out and work outside. And the work of the hospital is left to the students who are in KMTC. Today, we have so many cases of actually maternity negligence, where mothers are actually dying at the delivery table. Mr. Speaker, in as much as we say that a lot is being done, our people are really suffering. Dispensaries in those counties, they have no drugs, they have no equipments, and the distances, Mr. Speaker, especially in case of emergency, those patients travel on a rough road, which is over 200 kilometers. And especially the mothers who have complication, they do die before even they reach where they are being taken care of. Mr. Speaker, this is a very good report, and I think this is affecting most of the counties across the board. Senator Wambua talked about CHVs. In Kenya today, how can you pay somebody 2,500 for a month? That is even below the labor law standard. If we really want to keep the CHVs, Mr. Speaker, we need to formalize that particular structure. We need to actually facilitate to get service delivery. Mr. Speaker.
Apart from what the money is supposed to be doing. It is supposed to be buying drugs, they are not doing that. It is supposed to be paying doctors and nurses and even those who are casuals, they are not doing that. And so nearly the whole budget is doing something else that has no connection with health. And therefore, and then the governors are treating this budget and even the whole budget in totality that is coming from the national government to the counties, they treat it as personal and private. So, so that there is no moral obligation that they should be careful about misuse and mismanagement of the funds coming from the national government. And then on the side of doctors also, a colleague of mine expressed a concern about the clinics outside the hospitals and the pharmacies outside hospital and in towns, that patients are directed to go and buy medicine, to go and buy whatever they would get from the hospitals. And so there is a collapse of morality on the side of doctors, and then there is also trade attitude and making of money has kicked on our doctors and nurses, such that they no longer want to treat citizens the way they trained or they were trained as doctors and nurses. And so there is a total inhuman or inhumane in their attitudes towards the citizens and everybody. And therefore, making the whole system, when the governor is not in a position to be answerable and responsible for his job as trained, and then the whole system is collapsed because nobody is paid. Even those that are casuals, they are supposed to be paid some amount. Like my county pays people 4,000 a month, 6,000 a month, and then some of those who are better qualified, better paid, must have a relationship with the governor, either a relative or political supporters. And so the whole thing has lost meaning, and it goes down to when there is a gross mismanagement nationally and all over, why shouldn't there be an action taken even on one county government so that it becomes a lesson for the others? But because we go as senators and find findings, and then what do we do? Even if, the best report has been given, but what do we do? What is the plan of action? What is the next step after the report being given? So that is what is left, and therefore, because no governor has been punished or have been made to answer, therefore, they just continue with the mismanagement, with the rogue attitude that is collapsing the whole system of health as far as counties are concerned. And so people wish it would go back like it was. And so while we are happy that devolving of these activities have gone near the people, but those who are managing it are not properly doing what they are supposed to do, so that it makes the services better on the people and in the levels that are supposed to be near the people. Then, on the point of supplies, governors have privatized that part. Like my own county, the spouse of the governor is the supplier. And so she gets paid even without supplying a thing. So you find that there is no milk in the tea because she hasn't paid the supplier. And the supermarkets where maybe she would be taking sugar from, there's no supply because she doesn't pay. So all the supplies, even firewood, nobody brings firewood because she does not pay those who bring firewood. Yet, of all the contractors that are contracted to do work in the county, she is number one who is paid, and paid so much money ahead of everybody so that she is okay. And therefore, the whole system of supplies and suppliers have collapsed. Needless to say, they normally corruptly get awarded the project. So I support the report and wish action would be taken against even one county government so that it becomes a lesson for the others. Thank you very much. I support.
Senator Kadri Muma.
Thank you, Honorable Speaker, for an opportunity to contribute to the reports by the Committee on Health. Honorable Speaker, I support the reports on the counties, that is Kitui, Machakos, Makueni, Bungoma, Kakamega, and Kiambu, done by the Committee on Health. Honorable Speaker, whenever I speak on health, I always say that this is the one subject on which we must work collectively as a house to ensure that we contribute the best that we can to ensure that both the national government and the county governments do the best they can to deliver this service to the people. Honorable Speaker, the right to health is only second to the right to life, because when we don't have good health, we cannot do all these other things that we would want to do for development. So it is important that all leaders in this country, the governments at the national and county level, take the implementation of the right to health seriously. Honorable Speaker, I want to commend all the counties that were evaluated for the areas where they are strong. But the key thing in terms of our oversight is to point out areas where they are not working well. Honorable Speaker, if you check all the reports, there is one recurrent issue about the management of clinical waste by our hospitals. Honorable Speaker, this is a problem across the entire country. A problem that you will find with Kenyatta National Hospital and a problem that you'll find in all the counties. Clinical waste is actually an opportunity to further the communicable diseases. So managing clinical waste is actually a health act rather than just managing solid waste. It is an issue or something that our hospitals and our governments have never appreciated. So if you go to a number of hospitals, they hardly have any budget lines around incineration. They are not researching on the modern ways of dealing with clinical waste, and as a result, we are just recycling diseases because we are dumping clinical waste, sometimes mixed with other waste. If you went to Dandora, you will find that people are picking waste that includes syringes, that includes bags that have been used on patients, and many other issues. Honorable Speaker, maybe we need to come up, maybe the committee should recommend a motion around the issue of biomedical, of managing the clinical waste. Maybe we should even contemplate having the biomedical courses in our technical institutions so that we can actually create some industry around the management of clinical waste and be able to create jobs for our young people across the country. So I would urge that the committee follows up on this issue, being one of the issues that is common to all of the places that are found. I'd also like to speak to the issue of the mess. The equipment that were purchased in the first term of the Jubilee government, many of which were just put in boxes, and the committee has found that in some of those places, some of these facilities are not functional. This is a question we casually speak about, but I think it is high time the Senate came to this House with a report on how much we have paid as a country on this leased equipment that were forced down the throats of county governments, and which, some of which are still in boxes, but for which we are actually paying monies every year. Many of which have not been operational because we did not think through on how to operationalize them. We did not train the personnel to actually operationalize these facilities, and as a result, we do not have the infrastructure and the personnel to run them. This is a big issue that costed this country a lot of money, and sometimes the failures in our health facilities is designed because of those who are interested in making money through procurement. I think the Health Committee owes this country a final report around the issue of the mess so that people of Kenya can know what has been happening. Honorable Speaker, another issue that is important, that is cross-board, is the failure by county governments to remit deductions belonging to workers. This committee focused on the health workforce, but this is a problem across the counties. I have said it before this Senate goes off, after this session, one of the things we need to do is to compel all counties to remit the statutory deductions belonging to workers to wherever they're supposed to go. It is painful to hear that one would be a doctor dying of a disease because they cannot afford health insurance. They cannot be treated. What a contradiction. We need to actually take this seriously, Mr. Speaker. I don't know how we do this, so that the statutory remittances by counties must be taken seriously and actually cleared. The pending bill in respect of the workers' dues must actually be cleared. If there is only one oversight issue that we should focus on collectively as all committees and the entire Senate, is to help the workers in the counties to actually receive their dues. Honorable Speaker, that money does not belong to the county governments. That money is money that belongs to those workers. Why do we have this issue recurring with every committee report that comes here? We learn on how statutory remittances are not being given in respect of ECD teachers, in respect of health workers, in respect of those working in the agriculture sector. and we are doing nothing about it. I think we need collectively to be able to say, out of this report, the one or two things that we must do must include holding counties accountable to these remittances. Honorable Speaker, as you are aware, Kenya has adopted universal health care. Universal health care actually means that we are trying to facilitate every Kenyan who is sick to be able to access treatment. This does not mean free. There is nothing that is free. It means that we must collectively find the necessary resource to ensure that the most vulnerable among us are able to get equal access to treatment that we in Parliament are able to get. Honorable Speaker, it means we must have very prudent management of resources in the health sector. It means we must actually honestly be able to contribute for those who need to contribute. It means we must get rid of this sector, corruption, get rid of corruption from this sector so that every cent is able to go towards the care or the healthcare services. It means we reevaluate the amounts within the national, that the National Health Ministry is receiving vis-a-vis the county governments in order to take care. I don't subscribe to, I can see Senator Dulo is not here. She's talking of reversing the health function to go back to national government. I don't agree. Before 2013, it's not as if we had a functional health service. Devolution has actually brought health services to a better place, but we are retrogressing again because of rampant corruption, both at the national and the county governments. So we, as those who oversight, and this house in particular, because this house has no access to development funds with which you can play monkey business, this house must be the one that is the moral conscience of this nation on how we implement on the right to health. And I am pleading with all of us that if there is one thing that we must agree on, all of us, is that the health system in this country must function and function well. Honorable Speaker, there is the issue of health systems management. Health systems are one way of ensuring you ensure accountability in the health systems. I can see in the reports, we seem to have a failure of health systems everywhere. The digitization is failing, and Honorable Speaker, it's not just in the health sector, it's failing even in the revenue collection systems because people want it to fail. If it fails, then we have opportunity to steal. Honorable Speaker, I don't know what it will take for us to be able to put in place that health systems that will enable us to actually track how we are managing diseases in this country, how we are taking care of our patients. In fact, each county should be able to know exactly how many people it is planning for in respect of whatever non-communicable disease or other communicable diseases and so on. So health systems are important, and I'm glad that the Health Committee put their finger on this and are trying to hold all the counties accountable to this issue. Honorable Speaker, as we speak to the remaining of the counties, I want to urge the Senate that as we do this oversight, we should now start apportioning deliverables to every term that has been there. Sometimes you'll go to a county, you are talking about hospitals that have been there, operating with exactly the same budget from those days. Let us be able to evaluate to find out when Senator Kathuri moved in as governor of Meru, that Meru had X, and Senator Kathuri, now governor of Meru, has moved Meru by 10% in terms of the value of the health system. I am afraid some of the reports that we have speak generally. And as we found out in one county that I will not name, when we went to evaluate ECDE, we were taken to projects of the previous governor because this particular governor had not done anything. So I'm just alerting us that we need to be able to have oversight tools in Senate that can actually measure progress in every county, so that we don't have the trickery of governors showing us what previous governors did and actually using them to account for monies that they are not actually expending on those projects. So as I finalize, I want to ask the committee to work even harder in order for us as a country, one, to ensure even greater intergovernmental collaboration and cooperation, so that if Kiambu is doing well on X, if Homa Bay is doing well on X, and one of the things I know the president recently launched the maternal and neonatal mortality reduction program. I want to tell you that the counties already have an inter-county MPDRS, that is maternal and perinatal deaths surveillance system, that has helped some counties, amongst which is Homa Bay and Kiambu, that then recorded 0 maternal deaths for a number of months. We are hoping that that program can also move on to neonatal mortality surveillance, so that we do what it takes to also reduce child mortality or neonatal mortality within our counties. So the committee should also interrogate intergovernmental and inter-county cooperation for the better delivery of the health service. Asanteni sana.
Next is Senator Chalge. So before just a minute, let me first make this communication. Honorable Senators, we have a visiting delegation of teachers and learners from Musingu Boys High School in Kakamega County. Honorable Senators, I would like to acknowledge the presence in the public gallery this morning of a visiting delegation of 4 teachers and 130 learners from Musingu Boys High School in Kakamega County. The delegation is visiting the Senate for an academic exposition. On behalf of the Senate and on my own behalf, I extend a warm welcome to the delegation and wish them a fruitful visit. Thank you. I understand one of the members, senators, is an alumni of Musingu Boys. Senator Wakoli.
Thank you, Honorable Speaker. Naomba nizungumze kwa lugha ya taifa. Nikushukuru sana Mheshimiwa Speaker kwa nafasi hii ili niweze kuwakaribisha wanachuo wenzangu wa shule ya upili ya Musingu, ambayo mimi nilikuwa mmoja wao kutoka mwaka 1999, na hivi ni kudhihirisha kwamba shule hii kauli mbiu ni nidhamu na bidii. Mheshimiwa Speaker, nina furaha sana wanafunzi hawa kuja, kwa sababu siku zetu haikuwa rahisi kupata nafasi kupita mipaka ya mkoa Magharibi kuja katika jiji ila ni katika tamasha za muziki katika jumba kuu la KICC. Lakini zaidi ya hapo, Mheshimiwa Spika, mara kwa mara wenzangu jitapa vifua na kudai kwamba wao wako katika shule nzuri sana katika Kenya. Leo lazima watu wajue kwamba maji matulivu yana kina kirefu. Mheshimiwa Spika, katika jumba la Senate, Mheshimiwa Daktari Boni Khalwale alisoma shule hii. Mheshimiwa Wakili Edwin Sifuna alisoma katika shule hii. Mheshimiwa Alan Chesang alisoma katika shule hii. Mimi mwenyewe kiranja wa wengi, Mheshimiwa Spika, nilikuwa katika shule hii. Katika jumba la kitaifa, Mheshimiwa Spika, Mheshimiwa Fred Kapondi alikuwa katika shule hii. Mheshimiwa Fred Kana tulikuwa darasa moja kule Msingu. Mheshimiwa Tindi Mwale alikuwa katika shule hii. Hii ni kudhihirisha kwamba, Mheshimiwa Spika, katika historia ya Kenya, shule kutoa wabunge 6 sio mchezo. Ni kwamba ukiona vyaelea, bila shaka vimeundwa. Ndio kwa sababu tutaendelea kuchonga historia ya uongozi katika Kenya hii, kuendelea japo tofauti za kisiasa, kudondoa hoja za kutetea mnyonge katika Kenya hii, na kuwapa vijana wa nchi hii motisha na ari ya kufuata azma zao katika barasti ya maisha. Sasa ndugu zangu wanafunzi, mimi nilikuwa kiranja wa bweni la taifa. Nilikuwa vile vile kiongozi wa vijana katika mchezo wa vikapu. Nilikuwa katika kikosi cha Ngonjera. Na licha ya hayo, mnajua kikosi cha Jombi extra muzika, wale ambao tunapocheza kandanda, tunapocheza raga, sisi ndio tulikuwa tunaimba pale uwanjani, tukitumbuiza watu, na ukileta mchezo tulikuwa pia tunakabiliana nawe. Hii ninamaanisha kwamba, ndugu zangu, penye nia kuna njia. Bora ujisitiri na uwe mwaminifu kwa Mungu, mwaminifu kwa azma yako, na uheshimu walimu wako. Hapa unapoona ni viongozi waliobobea. Mheshimiwa Mungatana nikiwa shule hiyo nilikuwa namuona kwa runinga. Leo ni mwenzangu ananiita mheshimiwa. Kwa sababu gani? Fuata azma yako na usikize, kwa sababu wahenga walisema. Mheshimiwa Spika, hawa ndio hawaamini kwamba mtoto wa maskini anaweza pana azma hii akawa seneta katika nchi ya Kenya. So ndugu zangu na walimu, mimi ni mwalimu kitaaluma, nafurahi sana kuwaona mkiwaongoza watoto ili vile vile waweze kufurahia matunda ya nchi hii. Na Kipchoge alisema, chochote unachotaka hakuna kikomo, bora unafuata azma yako.
Maybe point of information maybe.
Mheshimiwa Spika, nimepaswa ujumbe huu miaka nyingi nilipoanza safari ya kuja bunge. Lakini kwa sababu ya heshima tu yake kama wakili, seneta aliyebobea, nimempa nafasi aweze kunijuza yale alionayo.
Mr. Speaker, I am amazed by this very beautiful Swahili my colleague Mheshimiwa, who is also a very good basketball player in our team, so I like to listen to his speeches. But is he aware that I didn't attend his school? I heard him say I attended that school. I didn't. I attended the Alliance High School, which produced very many ministers, Mr. Speaker, and continues to do so to date. I thank you, Mr. Speaker.
Yeah, I think you did conclude your welcoming remarks, Senator Okoli.
Dakika moja, Mheshimiwa Mstahiki Speaker.
Leo uko na inaitwa nini?
Ninabubujikwa na furaha mpito Mheshimiwa Speaker. Ndugu zangu, mnapoona maseneta wanachangia na kusifia shule zao, ni kuashiria kwamba uliko ndiko kitovu cha azma yako ama ndoto yako. Haijalishi kule unakotoka, lakini kule unakwenda muachie Maulana. Asante Mheshimiwa Speaker.
You know, Senator Chairai was signaling me because also he wanted to give you the list of MPs and governors, CSs from Kapsabet boys. Senator Catherine Muma, what is your relationship with the Musingu High School? Within 1 minute, kindly.
Thank you, Honorable Speaker. Honorable Speaker, I am a daughter of Ikolomani constituency. And Musingu High School is in Ikolomani constituency. My brothers went there. My nephews go to Musingu High School. So I wanted to also welcome the young men and the teachers from Musingu to this house and to encourage you to continue thriving. Senator Wakoli did not mention that last year you actually beat Kakamega High School in football. Was that correct? Senator, I hope you will actually see them at the back and be able to commend them for that very exemplary performance that they had last year. But just wanted to encourage you and to urge you that since you come from a constituency, can you be among the schools that can stand tall in terms of discipline, in terms of integrity, in terms of performance, so that all we can hear of Musingu is good, 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 and nothing for bad headlines. Karibuni sana.
Senator Chelagay.
Thank you, Mr. Speaker. I also extend a warm welcome to Musingu High School as I contribute, Mr. Speaker, sir, and also inform them that our standards are quite too high. Because out of the 5 presidents, we have produced the 2, so they still need to work hard to achieve that. Mr. Speaker, let me make the following. These county visits to Bungoma, Kiambu, Makueni, Kitui, Machakos, I want to commend the Committee of Health. And more so, the Vice Chair, Senator Omar, who she has been very consistent. Although I was disappointed she didn't come to my county, but I equally know the role that she has been playing as one of us in this committee. So, Speaker, we agree, and colleagues have said that there is consistent challenges that continue to bedevil the health sector. Mr. Speaker, I want to join my colleagues that the true definition of what evolution is will only be mentioned by one yardstick, and that is health. I don't agree with my colleagues who want to say, let us take back health to national government, because the national government, Mr. Speaker, their role is to provide standards. And that is what the Constitution in 4th schedule has provided for in Constitution in 2010. So, Speaker, it's very sad that we are still discussing mundane things about our health sector, especially in Kiambu, Bungoma, Kakamega, Makueni. I am happy that the students come from Kakamega. Mr. Speaker, it's very unfortunate if one of them falls sick, because when the committee visited Kakamega County Referral Hospital, they found a dilapidated ambulance that cannot carry the sick. And I don't think these handsome young men would want to be carried in such a ambulance. And I think Italanyi is doing a bad job there, Mr. Speaker. So it is important that the issue of health must and should be considered, Mr. Speaker, because there are a raft of issues that are similar. The issue of drugs expiry and unavailability of drugs despite the initiation of dawa mashinani by KEMSA. Can you believe, and I agree, when you visit most of these health facilities, Mr. Speaker, you will find so many pharmacies near many hospitals. It is because there are no drugs in hospitals. The reason most Kenyans, Mr. Speaker, see that share does not work is because you go, see a doctor, you are done prescription, but you end up buying drugs outside the hospital. And that is why many Kenyans might think that share is not working, because they have to buy drugs out of their pocket, because dawa mashinani by KEMSA has failed miserably, Mr. Speaker. There is the issue of dilapidated infrastructure, Mr. Speaker. Window panes, walls, you saw in Kakamega, in Bungoma, where my brother, Senator Wakoli, is coming from. The floor of the Bungoma County Referral Hospital has cracked. There is no, it is very pathetic. When you go to Kimaeti, Mr. Speaker, in Bungoma, the issues are similar. There is dilapidated infrastructure, dysfunctional incinerator, Mr. Speaker, and I saw the, the governor there wearing school uniform. I don't know which belongs to which school. Mr. Speaker, we should also know when you come from a certain school, you must maintain standards that come with certain. So in Bungoma, a county referral hospital in Kimaeti, Mr. Speaker, the story is very unfortunate, and therefore I hope the whip will do follow up to ensure that what we see in Bungoma County Referral Hospital, in Kimaeti, all of them, they have roofs, walls, floors, kitchen. Mr. Speaker, and you know, when you go to Bungoma County Referral Hospital, the kitchen is in pathetic state. And you know, Senator Wakoli will agree with me, the people from that region, and even the young men from Musingu, what is important to them is the kitchen. If the kitchen is not functional, if the busuma, the ugali is not well done, Mr. Speaker, it is hard to recover in such hospitals. So when you go to Bungoma County Referral Hospital and you find a dysfunctional kitchen, you are doing disservice to the Mulembe nation. And the governor of Bungoma should and must be called to order, Mr. Speaker. There is the issue of asbestos or asadias. Most of the hospitals that we saw in Kitui, anywhere, in Makueni and many other areas, Mr. Speaker, you have to appreciate that the issue of asbestos has been condemned. But most of these facilities do not have resources to remove them, Mr. Speaker. We want to challenge the governors through FIA, Facility Improvement Fund, which we pass as a house, that they should use those resources, Mr. Speaker. The issue of deterioration of physical infrastructure is a big concern, Mr. Speaker. Even when you go to Makueni County Referral Hospital and Makuyuni, you will find, Mr. Speaker, that most of the hospitals continue to have dilapidated in Makueni. The issue of Makueni Level 4 and Makueni County Referral Hospital, Mr. Speaker, we have a dilapidated kitchen, crowded ambulance. There are a number of them. When you go to Makueni County Referral Hospital, it's very bad, Mr. Speaker. Even Makuyuni, there is understaffing challenges and also lack of laundry, Mr. Speaker. And when you go to visit, and when the health committee came to Kapsabet County Referral Hospital, we found that most of the bed sheets are dilapidated, Mr. Speaker. They are in bad shape, just like what we see in Health Club here in Bunge, where most of the towels are in pathetic situation, Mr. Speaker. Mr. Speaker, the issue of, and therefore, Makueni, where my brother, Senator Governor Mutula Kilonzo, should up his game. Because I expected a lot from Makueni, because we saw them, they had an unqualified opinion, Mr. Speaker, which is, I expected Makueni County, Makuyuni Level 4 in Makueni County should have performed. Mr. Speaker, when you come to Machakos, we are still discussing lack of water. Mr. Speaker, when you visit at River, Level 4 Hospital, Mr. Speaker, there is no water. If we are discussing issues of water, issues of lack of salt, issues of dilapidated kitchen, issues of unbroken window panes, then the governors are doing a bad job, Mr. Speaker. And that might have been the reason, Mr. Speaker, you saw the governor of Wajir, Governor Ahmed Abdullahi, Mr. Speaker, was crying during the Madaraka Day celebrations in Wajir Stadium. He was not crying because he was emotional. He was crying because out of 50 billion that has been given to Wajir County government, nothing has been done in terms of health services in Wajir. You saw when we visited Wajir, Mr. Speaker, the TB, people who are treated with TB are living outside, Mr. Speaker. The disposal of asadas in Wajir Hospital is pathetic, and therefore, the governor of Wajir was crying because when he looked at the Wajir people, he realized he has done nothing despite receiving over 50 billion as a governor in his tenure, Mr. Speaker. While we continue to thank the president, and I expected to see you there, Mr. Speaker, but since the speaker himself was there, I knew you were in Meru handling Jurinjeke matters and preparing to run for the governor of Meru. And I'm told you are called Kamia nowadays. Mr. Speaker, the issue, another point I wanted to make is on the issue that we saw in Athi River. And I want to challenge, Mr. Speaker, that our counties, we must look in Kiambu, because I want to be very precise.
There's a point of order from Senator Veronica Maina.
Honorable Speaker, I want to raise a point of order on accuracy of fact. Honorable Speaker, is the Honorable Senator in order to indicate that the Governor of Wajir was crying because of having failed to do what he was supposed to do on the hospital and health infrastructure, while in actual fact he indicated he was having tears of joy to see the celebration of Madaraka having recognized a county that was treated as an outlier county or marginalized or peripheral county, and he acknowledged that now the president had brought that county to the mainstream and considered it good enough to host the Madaraka celebration, a historic event which has never happened in Wajir County, Honorable Speaker, and which I had the honor to attend and would have also loved to see you there, Honorable Speaker, though you had other engagements, maybe in Meru County. Is that, Honorable Senator, in order to indicate that the governor cried for different reasons than what he enunciated on that day?
So can you verify now your facts?
No, Mr. Speaker, I thought Senator Veronica wanted us to know that she attended the Madaraka celebrations, and we're happy she did that. If she wants information about the performance of Wajir, the report has been tabled by the Health Committee, and Senator Omar is seated to her. She can share with the report, and I'm willing.
You know the issue is you arranged that the governor for Wajir County.
Yes.
Shed tears.
I said the
because
governor
of
was emotional. I didn't say he's shedding tears.
So that is the point of order from Senator Veronica.
I said, Mr. Speaker, if the answer can bear me out, I said he became emotional. I didn't say he shed tears.
Actually,
so I don't know
said
where.
He was not emotional, but
Yes.
You know, the answer is very clear, and I was really keen listening to you. I thought there will be a member who might raise a point of order on your statements.
Mr. Speaker, I think the issue is very
how
simple.
can you prove about the emotional issue? How can you prove now to this floor, to this house?
Mr. Speaker, I have, and I will table, and it is part of the documents, on the report by the Health Committee of this house that tabled the report on the status of health.
It was not the report which was being discussed in Wajir. It was celebrations for Madaraka Day celebrations. So how can you table now a report on the county?
Mr. Speaker, if it will ease the house...
Can you kindly withdraw that?
Yes, he was shedding tears. He didn't shed tears, but I say he became emotional. So that is the point, Mr. Speaker. So, Mr. Speaker, on Kiambu...
Can we withdraw that part about the non-performance? Please, you have to do that.
Which one?
You know when you arrange some issues that you can't really substantiate, and this governor...
So I withdraw the part of shedding tears,
cannot be
Mr.
able
Speaker,
to come to this floor to defend himself.
So, Mr. Speaker, I withdraw the part shedding tears, but the fact remains that there was a report on Health Committee that indicted, and I wish Senator Omar, and it is part of the documents. So I have withdrawn the part of shedding tears. So I proceed, and there was a report that was tabled on even, and I seconded that report, and it is part of documents.
Information from Senator Mariam?
No, I thought that report is before the House.
Senator
Can I proceed?
Are you ready to be informed?
Maybe Senator Omar can inform me, because she is the owner of the report on health.
Senator.
Thank you, Mr. Speaker. Mr. Speaker, I wanted to inform the Senator that what he is contributing is two different things. This is Madaraka Day, and the other one is about the report we have tabled in the Senate. Yes, the report has so many discrepancies. Nothing has been done, but it is there. But when it comes to emotional issue, Mr. Speaker, it is about the northern Kenya, which President has recognized in Madaraka Day. So let the Senator to withdraw on the issue of emotional on what has not been done by the governor. It's only that. If he withdraw that one, the report is the way it is. The recommendation is there. Thank you.
He didn't withdraw about the shedding of tears, and he has withdrawn that bit.
Mr.
So
Speaker,
can you really discuss the report without censures?
no, Mr. Speaker, we were discussing, I heard my colleagues had mentioned the issue of health across the country, and they were tying him to the report, so I don't know why. I even had a senator here speaking about Ebola, which is not part of the report. Mr. Speaker, anyway, let me proceed, but I will restrain myself to the Kiambu, Karuri, Kiambu, Ruaka. Mr. Speaker, Kiambu, in as much as there were some issues, we realized that their maternity are overcrowded and missing mosquito nets. So if you have us discussing, Mr. Speaker, the ODM party leader is in the house today, Senator Oburu Odinga. If you have us discussing about non-availability of mosquito nets in maternity ward in Kiambu and Karuri, and also Ruaka hospitals, is very unfortunate. And even overcrowded maternity. In fact, this committee were denied data of mortality to the hospitals, Mr. Speaker, which is very unfortunate, Mr. Speaker. Even the rehabilitated infrastructure, and Mr. Speaker, in Kiambu, people are operating in a funny way. You can just walk into a Kiambu hospital and walk because there is no identification documents. The nurses there, the staff are not wearing badges, Mr. Speaker, which is very unfortunate, Mr. Speaker. And even the issue of mortuary, we agree, and I agree with my colleagues, that the issue of mortuary, Mr. Speaker, we must agree that there is a problem. We don't want Kenyans to have international departures to heaven. But we must agree that the issue of mortuary is still a problem. All over counties, even in Nandi, I have only one functional mortuary in Nandi Sub-County Hospital, but we don't have in other, and there are many dilapidated, even here in Kenyatta National Hospital. So, Mr. Speaker, I want to appeal to the committee that after they done visits, because they have done Nandi, they did Elgeyo Marakwet, they have done others, Mr. Speaker, we must also visit referral hospital, Mr. Speaker. You know, referral hospital are suffering because of overcrowding by counties. Like Eldoret, Moi Teaching and Referral Hospital, I want to appeal to the health committee, if it is not too much, through the vice chair, to visit Moi Teaching and Referral Hospital of Eldoret, because it's slowly collapsing, Kenyatta National Hospital, Mbagathi, Mr. Speaker, so that we can ensure that as a county, we move forward as a country, Mr. Speaker. Finally, Mr. Speaker, on this issue of stall projects, health projects, as I conclude, when you look at counties, I think like in Nandi, mother and baby, you have seen most of them, Mr. Speaker, across, and I'm happy that Senator Omar-led committee has noted this issue of infrastructural problems, Mr. Speaker. Because even in my county, the governor has been doing mother and baby for the last 10 years, and yet it's not complete. You go to many counties, and I'm happy this report has talked about infrastructure delay, even in Bungoma, even in Kakamega, Kiambu, Makueni, and Kitui, Mr. Speaker, and even Meru, Mr. Speaker. There are some of the dilapidated infrastructure. Like, for example, in Wazingishu, they have stall projects worth 2.4 billion, which is the highest in the country, Mr. Speaker. And these stall projects, they have paid 1.0 billion. Yet all of them are stalled. Like when you go to Siwa Level 4 Hospital, when you go to Tarbo Sub-County Hospital, when you go to Keses, Mr. Speaker, all of them are stalled, yet 1 billion has been paid. And you find yourself funny in most of these counties. Mr. Speaker, they are doing a snake park worth 5 million. And they have used 4.8 million for a snake park. Yet there are no drugs in hospital. For example, in Wazingishu, you have a snake park that have paid 4.8 million and 5 million. You know, in my culture, if you do around with sex, we are worried what you want to do with the snakes, Mr. Speaker. Because it is not like India where snakes are being used for sports. Snakes are used for other things, Mr. Speaker. So we must, and even they are doing, I'm wondering, they are doing a museum worth 25 million in Wazingishu. Yet they are not completing those toll projects. Even in Nandi, Mr. Speaker, can you believe in Nandi dispensaries are closed between Saturday, Sunday, and they open dispensaries between 8 a.m. and 5 p.m. I don't know whether sickness has a way of coming. So I don't know, can sickness not come after 5? This is a problem that we must face as counties. Finally, I want to challenge counties on the issue of Ebola preparedness. We want to hear counties discussing what are they doing to prepare the issue of Ebola preparedness. And I've had my colleagues, Mr. Speaker, we have to accept there are Kenyans working in DRC. This is not a corridor where our drivers drive all the way to DRC. Our colleagues who are opposing Ebola preparation by the country, telling us that Kenyans who are in DRC or drivers, they should be locked out. And Mr. Speaker, what people are not telling, and I'm happy the President said in Wajir, what people are not telling, the biosecurity agreement was signed in 2015 by former President Uhuru Kenyatta. When 640 a plane from China landed here during COVID crisis, no one went to demonstrations because it was Uhuru Kenyatta. But when President William Ruto prepares facilities to fight COVID, not Ebola, which 15 cases have been reported in Uganda, the demonstrations are being done. And we don't know to blame our school children when they burn down their dormitories because they have seen what their parents are doing in the streets. They are burning houses, they are looting, Mr. Speaker. So we must be ready as a country, and I want to encourage the President, the government, led by the CS Aden Duale, that we must be ready, prepared for Ebola preparedness, Mr. Speaker. It is the obligation of government to ensure that we have necessary facilities to prevent Ebola in this country. Mr. Speaker, with those many remarks, I beg to support this report.
Senator Veronica Wahetian, after you are done, you approach the chair for some more guidance.
Thank you, Honorable Speaker, for this opportunity to comment on the report that has been brought to this House by the Health Committee. Let me first commend the committee for the good work they have done. Honorable Speaker, they carried out the mandate that they were supposed to carry out, and I would say this is how oversight is supposed to be done. Oversight of functions that are devolved must be followed up by the relevant committees to see whether they are actually implementing what is expected, that counties are implementing what is expected. So the committee has gone out there to the different hospitals from Kitui, from Makueni, from Kiambu, and a few other counties, Machakos also, and they have assessed the state and the quality of the infrastructure, facilities, hospital equipment, and even provision of emergency services. They have assessed the automation of healthcare provision systems for patients, drugs, and commodity management. They have assessed the availability of requisite healthcare personnel, the gaps and challenges in the counties that are cited in the report, and they have also assessed the availability of training and capacity building programs and avenues for healthcare workers in emergency healthcare, specialized services and referrals. Honorable Speaker, the shocking thing is that the report they have returned here is not something we did not really expect, because we do know that our healthcare has still not yet achieved the standard and the quality that it should have achieved by now. But shockingly, Honorable Speaker, is to see that the same problems we may have discussed in year one when we were in Senate are the same problems in those hospitals that we are discussing today, which is year 4, just before the tenure of this Senate comes to an end. And we ask ourselves, Honorable Speaker, in the mapping of the healthcare, the scope of healthcare services, and the standards that are supposed to be rendered by the healthcare services in our respective counties, what is going wrong? And what exactly do governors think about the right to healthcare, the right to health for the citizens of Kenya? I think, Honorable Speaker, to be fair, national government has done a lot, even rolled out the universal health coverage program, Honorable Speaker, that intends to ensure that citizens have access to health services, have access to health care, have access to medical medications, Honorable Speaker. But unfortunately, the counties are not holding to the end of the bargain. I have especially looked at the report that was returned against Kitui County, which has a population of about 1,136,187 people. If you look at what's happening in Kitui County, Honorable Speaker, it is pathetic to see that even the TB patients are being boxed within a cube inside an ordinary ward.
Now, who does that, Honorable Speaker? This country is the one that is even giving medical personnel to other countries within the region. Even a lay person knows you cannot put a TB patient who is at a very infectious stage next to other patients. It's no wonder, Honorable Speaker, that you'll find the way counties are running these hospitals is in a very, how would I say it, lackluster manner, kienyeji, if I was to use Kiswahili. I have even looked at the renal unit in Kitui. You should look at these photographs that are attached to this report, Honorable Speaker. It is a big shame if a county cannot even clean up an area and it's within a hospital setting.